talk about the format before you jump in?
Sure.
Okay.
All right, we're live.
Thank you.
And everything's good from your end, Leah?
Yep, we're recording, we're live stream, we're good to go. I'm going to mute myself.
Okay. Great. So we're going to get started to stay right on time. My name is Joy Jordan. I'm the Community Engagement Coordinator for the district. Just a couple of little notes before we jump in. First, this session is being recorded and will be posted on the website tomorrow. As always, please make sure you're muted if you are not the one speaking. Dr. Carpenter will give a few remarks to start things off, and then we can jump into the Q&A portion. You can do that two ways. You can use the raise hand feature on Zoom and we'll get to everybody in order, or if you prefer, you can put a question in chat and either we'll be able to answer it right in the chat or we will read it aloud for Dr. Carpenter to answer at a break in the conversation. So I think that's the business end of things. So I will turn it over to Dr. Carpenter to get started.
Sure. I guess I want to just start and just acknowledge. I think we have a small enough group in the global scheme of Zoom meetings that if there are things that people specifically would like me to focus on, I'd just like to give you a chance to sort of come off mic and just say, hey, I'm wondering about this, and I'll just make sure that I incorporate that into what I present on the front side. So I'll just invite people to kind of chime in for a moment, and then I'll give a quick overview, and then we'll just open it for questions. Cindy.
I want to know about the ESSER funds.
Okay.
And how they're being distributed. And I talked to Mark in the spring and I emailed him today about the possibility of making sure that the special education and the reading specialist teachers also have their own materials to use,
Okay.
especially since in small group collecting data.
All right. So one of the things that I will share is I'll present just what we have on the website regarding ESSER funds, and I know Michael McMillan, our business manager, is also on this, and Mark Smith, our curriculum coordinators, on here, so we can kind of tag team and share on that as well. Are there any other things that people would specifically want to make sure that I address so that we can hit those in some opening comments? All right, so hearing nobody else, let me just share out. I'm going to share my screen. What I'll share is I had a school committee meeting last week where I shared with the school committee a reopening plan that was consistent with the direction that the state has gone. And the school committee has voted to adopt that reopening plan. And one of the things that I also want to emphasize is that the last slide of that plan talks about that all of this is going to be subject to change because we just don't know where COVID is going. Things have continued to be very very fluid over the last year and a half, and I anticipate things will continue to be fluid. My hope is, and I think all of our hope is, as they are fluid, we hope that we just keep tracking in a better direction. And my sincere hope is that that we may be starting mask, but I hope we get to a place with the schools and back in our community and society that that we see ourselves emerging and on the other side of this, and being being somebody who was both a biologist before I went into school administrator and somebody who's always enjoyed reading history. if we go back to the last major pandemic that that the world and our country had to deal with, it was the Spanish flu, and the Spanish flu took 2 full years before the world emerged from that. So 2 years, 4 waves, and I'd like to hope that we're clearly in a 3rd wave of this one. I'd like to hope that we don't hit that 4th wave and that we do emerge in the spring of this coming year, and that's kind of consistent with what happened almost 100 years ago. So anyway, let me start on the. I'll share my screen on the reopening plan, and I'll stop after the reopening plan. I'll spend some time answering questions, and then I want to definitely make sure that we address Cindy's question on the ESSER money, which is this emergency relief money that schools are getting to close some of the gaps that we've seen that have occurred with COVID. So I'll start sharing. So this is the presentation I shared last week at our school committee meeting. So in terms of helping our school system and our state nation get back to normal, both the American Association of Pediatrics, the Center for Disease Control, and also the Massachusetts Department of Education and their Department of Public Health are recommending that if you're able to get a vaccine, please do get a vaccine, and it will help us get back to that place of normalcy sooner. So at the moment, children 12 and older are able to be vaccinated. The bulk of our staff are vaccinated. The bulk of our seniors at the high school are vaccinated. And as they go from senior year down to the 12-year-olds, we see slightly fewer students vaccinated, but we need to support those rates getting up, in part because the sort of progressing towards a new normal that the state has set out has a vaccination threshold of making sure that 80% of your school is vaccinated, staff and students, before you start unmasking and moving to those next steps towards normal. So the recommendations of health professionals on masks, again, the American Association of Pediatrics, the Centers for Disease Control, and the Mass Department of Education and Health, they are all now recommending masking for all. Initially, DESE was only recommending masking for the unvaccinated, or only recommending masking for the unvaccinated students and staff, but have since changed that recommendation and voted to support the commissioner in issuing a mask mandate last week because of the direction that COVID has taken, and particularly the direction COVID's taken in the last couple months, given the Delta variant. The Delta variant is something that became rather troublesome, and the CDC subsequently this summer, because of clusters that they've seen in breakthrough infections, is recommending that even in indoors, in areas of substantial or high transmission, that all individuals are wearing masks indoors. And at least at the moment, on the Cape, we're in that area as the CDC defines it as substantial or high transmission. And at the moment, unfortunately, most of the country is. The hope is that that things will get better here as we progress through the school year. In terms of masking, I initially made a recommendation to the school committee that we mask. We have inserted into all of our student handbooks under the health and safety section in the electronic student handbooks for each school. There's a section in there that people can read on that's entitled "Masking to Assure the Safety of All Students." It's consistent with with the language that the Massachusetts Association of School Committees is recommending school districts adopt. And as I said, we'll reevaluate masking over the course of the year. The state has issued this mask mandate at least through October 1st. They'll reevaluate on October 1st. They at least set out 80% vaccination rates as a minimum that they want to see before schools start to unmask. And again, I think it's important that we keep in mind that that the CDC is also recommending that we remain masked as long as we're in seeing COVID transmissions that are in the high or substantial range. So we always throughout this pandemic have been looking at our local data and have been trying to sort of shift and adjust our plans as time goes on, and we'll continue to do that this year. In terms of buses, there's actually a federal public health order at the moment for all public transportation. It doesn't matter if you're in a taxi, a bus, an airplane, or a train or subway, that you need to mask. So on buses, all students need to wear masks. And we, again, this year are encouraging parents to provide transportation for their students, only because it will help us keep the density, the number of students on any given bus down. And I know it pains me as somebody who's environmentally focused to encourage folks to drive students to school when there are buses that are picking up students, but it would help us, and it would help all in terms of public health, the more parents that we can get to support driving students to school. But I also know that that's not possible for every family. So we do have assigned seating at the elementary and middle school levels. The high school students, their ridership on the bus is a little more plastic. And if we do have to identify close contacts, we've had a lot of good success with talking to high school students about who they sit next to on the buses. We will keep windows open, and again, that's going to be weather dependent to just improve air circulation within the buses. In terms of spacing, students can expect to see a minimum of 3-foot spacing between desks in classrooms. Last year, we would have had 6-foot spacing, but we had a significant number of our students that were electing for distance learning. This year, we'll see at least 3 foot. In many classrooms, in most of our classrooms, there's going to be significantly more than 3 feet. It doesn't mean that students won't work together. So there were small group activities that happened last year. There'll be small group activities happening this year. One of the things we're glad to see back this year is that we'll have band in course, and they'll have band in course. They'll be indoors. We'll have them in spaces where we can have enough spacing to have the kids safely spread out and have those activities happen inside. But but this time last year, there were guidelines that there was to be no band or course inside, and you can imagine that it had us doing a little open field run, and we were having choir groups rehearse and into the cold months last year outside. Lunches last year were happening in classrooms. This year we're going to see lunches happening back in the cafeterias. The cafeterias will have the students spaced out. So at our tables that would normally have 8 students at them, there'll only be 4 students, so that there is 3-foot spacing between those students. Mornings will have breakfast will be grab and go at kiosks as the students come in, and they'll eat their breakfast in the building. During lunches, where when feasible and where feasible, we'll be encouraging kids to eat outside as well. both at our high school and at our middle school, there are grass table spaces immediately outside exterior doors from the cafeteria. So we can do that much more feasibly at our middle school and high school. Our two elementary schools really don't have nice open spaces right off the cafeterias. The last thing there is that that JAWSOM, which is a student support a time during the lunch block at the high school, will be back. We had JAWSOM put on the back burner during the challenges of last year, but it'll be back operating at the high school this year, and that again will support us in decreasing the density in our cafeteria at the high school. In terms of how things will differ this year when it comes to identifying close contacts and quarantining, the Department of Health and the Department of Elementary and Secondary Education, defined close contacts as being within 6 feet of a positive individual while indoors for at least 15 minutes during a 24-hour period. But then they go on to define close contacts when it comes into a school situation. And they come up with a whole list of things initially that DESE came up with, a whole list of things that would exclude somebody from being a close contact. So one is if they were asymptomatic and fully vaccinated. Two is if they were in a classroom situation, since they're wearing a mask, even if they were 3 feet apart, and even if that class was far longer than 15 minutes, they would be excluded. If they were on a bus and the windows were open, or if they had COVID in the last 90 days, any of those things, DESE would say, those shouldn't be close contacts. We are going to take a different approach there that's a little more conservative, because if you look at the DESE definition, you would have to literally be sitting in somebody's lap for 15 minutes to be considered a close contact, which differs from the definition that the CDC has. So we'll be taking more of a CDC approach towards defining what a close contact is. It's a huge difference from how we dealt with this last year. So last year, if there was a positive student or staff member in a classroom, we were quarantining the entire classroom. If there was a positive on a bus, we were quarantining the entire bus. If there was a positive on an athletic team, the entire athletic team. This way, you could imagine in any classroom situation, we're just talking about those students that are immediately adjacent to where that child sits on a bus, on a classroom, or in a classroom, are the ones that we would focus on and say, okay, these are the close contacts that we should consider quarantining. But we're putting in place something this year with the support of the state that's called test and stay. So if a child or a staff member is a close contact in school, and I want to emphasize that if it happens in school or on a bus, we'll have the option of putting in place test and stay, where the child or staff member can stay in school. But what we would do is we would test them every morning for the next 5 school days with these. It's a pretty non-invasive binexnal test that the student can literally swab the inside of their nostrils, and the nurse would put the swab into a little packet. There's a drop of reagent goes on it. 15 minutes later, we can see if that sample comes up positive or not. So we can test to see if the child or staff member is safe to be in the school building. We would do this for 5 days. That covers the time when they would likely become positive. So we can ensure that that person who has been exposed is going to be safe to be in the building. Again, It's if it happens on the school side, and the other thing here is they have to be asymptomatic so that they're not feeling sick. So you're not having somebody that was a close contact, they start feeling sick. You don't have them come in feeling sick and get tested. It's only if they're continuing to feel fine. But it's only if it happens in school. If it happens outside of school, unfortunately, we won't be able to operate that way. We'll have to follow the CDC guidelines for close contacts. And the presumption is if it's happening outside of school, more than likely that close contact exposure didn't have masking on, was probably for a lot longer, a lot more intimate, a lot closer. So if it happens outside of school, or if the individual elects not to do test and stay, the CDC guidelines are that the individual should quarantine for 10 days, but they could come back after the 7th day if they have a negative PCR test. So we would follow that CDC guideline. Again, that is an improvement of following the CDC guidelines over how we initially launched into this last year. So last year, the CDC guidelines were that quarantining should be for 14 days, and there was not an option to come back earlier. This is allowing, as modern medicine has come to understand more about COVID, and when the exposures happen, and when individuals become positive, they revised their guidelines. We're following that new revised guideline. Clearly, if the individual is a close contact and are symptomatic, they would be staying out of school, encouraged to be tested, and following the quarantining guidelines that way. So in terms of testing, the state is offering free COVID testing through the schools using these Binax Now kits. We're going to be working with a company called CIC Health for these testing. CIC Health actually has an electronic consent form, and we are just working out some of the logistics of that consent form, and imagine in the upcoming few days, we'll be communicating both out to staff and to families and inviting them and encouraging them to fill out the testing information in advance. So if we ever have to test, at least the information is all there and the consent is there. We will not be testing anyone, particularly our students, without calling the parent first afterwards. You can imagine that if your child is a close contact, we're not going to go and be testing them without reaching out to you and letting you know that they were a close contact, and just making sure again that that we can go and do the test and stay. We also have the ability through the state that they will be providing the resources to do the pooled testing that we did last spring. I'm not sure how many more weeks it's going to take for them to get fully mobilized on pooled testing, but we will do that. We're going to be changing the name of it to maybe be a little more clear on what it is. It's just a routine COVID safety check, and I would imagine that we'd shoot for every Monday to have individuals who are agreeing to participate in this get swabbed in advance, and it allows us to go and see if there are individuals who are asymptomatic, to go and identify them and work with them, their parents, their primary care physicians, to isolate them through a quarantine and make sure that they're getting the appropriate medical support there. The last type of testing that is available using these Binax Now tests is if a child or a staff member ends up in the nurse's office, is showing some sort of symptom of COVID, before either of them go home, we can offer to the family or offer to the staff member to test them using a Binax Now test. We would encourage them, regardless of how that test came out, to follow up with their primary care physician, and more than likely their primary care would suggest getting a PCR test, but it would at least give one data point when they're leaving us as to their COVID status based on these Binax Now tests. The Binax Now test, it's a rapid antigen test. It's not as sensitive as the PCR test, which is considered to be the gold standard. But again, it's if the parents provide or request that when the child is getting sent home, or if the staff member is requesting it when the nurse is encouraging a staff member who starts to feel ill during the school day before they go home. And as I said, that's sort of the meat and potatoes to what how schools would be reopening this year. I'll stop there, but I do want to emphasize that that what we've learned over the last year and a half is that things with COVID have been quite fluid. These guidelines are likely going to be adjusted by DESE, likely going to be adjusted by the CDC over the upcoming months, and we're going to have to roll with those changes, and we'll keep you updated. And I imagine we'll have several more of these conversations with the superintendent. So I'll stop there to answer questions, and then we will jump in to Cindy's question about the ESSER funds.
Scott, we had a couple of questions in the chat. Kelly had a question about test and stay prior to you discussing it, so I don't know if she still needed clarification. And then she had an additional question about exactly how the lunches are going to be laid out for safety. So I will let Kelly jump in now to clarify exactly which parts she still would like you to speak on.
Hi. I have two questions. First, the lunches, and I'm talking about elementary school.
Yep.
I'm just concerned that we are not doing 6 feet apart when we know the children are going to have their masks off. CDC says that we should have, if we can't maintain 6 feet, we should have masks on. Obviously, that can't happen when we eat. Now, theoretically, adults, when we eat, we're actually eating, but children, when they go to lunch, are talking to each other. So I guess I'm just concerned about what is going to happen, that they're not 6 feet apart. And are they facing each other? That was another recommendation last year, was that everyone face the same way. Is that no longer the case? I mean, how are we assuring that we're not spreading things through cafeteria use?
So all good questions. I would say if I think, I can't remember which, I think it was at the school committee meeting. I think Mary Aldeck, principal at Harwich Elementary School, was sharing just a visual of the seating chart that they've come up with. We've added, we've not only removed half of the seating at each table, we've added a whole bunch of more tables. So they're the students when they are the only ones that are facing each other are on opposite sides of a big round table. So they're probably pretty close to 6 feet head to head apart from each other. And we fully acknowledge that, the cafeteria, the cafeteria monitors that are supporting the kids during this are going to be keeping the kids at tables. We have, so each table has a seating chart so that if there is a child who is positive, we know who's sitting at that table. So we're doing what we can to provide that step towards normalcy, but also trying to provide that spacing. But as I said, from a head-to-head standpoint in that cafeteria, it's they'd be on opposite sides of the big round tables, are the only ones that are truly head-to-head.
I mean, was there any consideration about having elementary continue to stay in their classroom? I mean, another thing that's been recommended if you can't be 6 feet apart is cohorting. That was another one of their layers. And so I'm just worried that by putting them in the cafeteria, we are again neglecting the idea of cohorting. We're losing that layer.
Yeah, it's we talked about do we have them in the classroom? I think they will be spaced out, probably with more space as the cafeteria is set up than when they'd be in a classroom with all of the students back in. Last year, we have to keep in mind when we had kids in an elementary classroom, there were about 1/3 of the kids were at home in a distance learning situation. So, so we have more kids in any given classroom. So they're probably more spaced in the cafeteria than the way they would be next in a classroom if we were to have them back in classrooms this year.
Okay, thank you. I did have another question about test and stay. I'm sorry, I'm trying to be
No,
quick.
that's fine. No.
So, I mean, I'm wondering where DESE came up with the idea for test and stay. I looked closely at the CDC guidelines, and they're still saying that if you were to develop, if you were to become positive, you are contagious up to 48 hours prior to getting a positive test. So by letting people test and stay, I mean, and I get it, it's convenient. We all want it to be a lot easier. But I mean, it just seems to be in the face of the science here that we're saying that we're just going to test them. So then theoretically, someone could test positive that we knew was a close contact. They test positive on day 3. We got to go back 2 more days. And, now maybe we've exposed more people. Like now we've exposed the gym teacher and we exposed whoever.
Kelly,
I'm just concerned about that.
No, I definitely hear you. If you'd like, after this conversation, shoot me an email, and I will send you the link that DESE used behind this. So it is based on science. So there was a study that was done. I'm pretty sure I printed it out and read it. I'm pretty sure the study was in schools in England. And what they were comparing is in all of these cases where they were quarantining, how many individuals that are getting quarantined ended up turning positive while quarantined, and compared that to the other, sort of like a control in the experiment. The experiment is a school setting where individuals who were close contacted did have 5 days of this rapid antigen test, 5 consecutive days, and how many of that group ended up becoming positive. And what they showed is that if you do this with fidelity, you should not see more individuals becoming positive because you opted for test and stay versus a quarantine situation. So, and to the best of my knowledge, I think in the guidance that came from DESE, I believe there were some aspects of Utah that were actually pioneering this sort of approach last year.
Yeah. I would love to see that, whatever that study is. I will email you and reach out about that, because my concern is that, especially with the Delta variant being something that is much more contagious for children, and more contagious in general, I just want to make sure we're not being foolish in this. I mean, I'm just looking at what keeps happening to the Red Sox right now. I mean,
Right.
And I'm not trying to be facetious in that. It's just, it's clearly more contagious, and I would hate for us to be so careful for so long and then let our guard down, and have something terrible happen to our children.
Right, and that's why, during the presentation I was just sharing, I have very intentionally elected to steer us towards a more conservative definition of what close contact is, and it's actually even more conservative than what CDC is recommending for school children, because I think we need to take a little more conservative stance right now, see how our data plays out with regard to Delta, And yeah, and if we're tracking better, then maybe we can shift closer to where where DESE was going. But but I do think we need to be a little more conservative on the front end, and because at the end of the day, the focus is how can we safely preserve and maximize in-person learning for for all kids, and that's what we're trying to do here.
Okay, thank you. I appreciate that.
There was another question in the chat, and this was essentially what happens when a student is quarantined or home ill with COVID. Is there going to be a remote learning option for those students?
So good question. There isn't going to be a remote learn in terms of like a stream. There is learning available. So this just the same way that that teachers in the past, because we have run schools for eons where kids get the flu or mono or chicken pox or whatever and are home for for a handful of days or more. And and teachers are great about providing lessons, providing here's the reading we're doing. So the teachers will continue to do that the same way that they have before. But if they're asymptomatic, the hope is that families will work with us to take advantage of the test and stay. So so asymptomatic in school close contact exposures. The bulk of the individuals that we quarantined last year should be able to stay in our classrooms this year by using the new definition of close contacts and that test and stay option.
We have another question in the chat, and that is whether the families and community will be made aware of what the current percentage is of vaccinated staff and students at, this is particularly about the high school, but I'm assuming it pertains to all of our buildings and district-wide.
Yes, so we'll go put that together. I shared it with, I shared a graphic that's about a month old and probably pretty obsolete with the school committee just about a month ago. We'll go at the beginning of the school year, compile that, and I'll share it at a school committee meeting and put it out for everyone. We were getting pretty close with our seniors, and I'm guessing we're probably even over the 80% threshold with our seniors at the high school. And again, it seemed, looking at the initial data from this summer, like every year of the juniors were a little bit less than the seniors and the sophomores a little bit less. So we need to really work on supporting supporting those those vaccinations and just educating families. And we will work with our local boards of health to to offer vaccine clinics here locally too.
There are currently no more questions in the chat. I don't know if anybody has a hand raised. I don't see that, but now would be a time to jump in if you have questions.
I'm practicing my appropriate wait time. So,
Scott, excuse me, there was a follow-up
sure.
About the current percentage at the high school of the vaccinations. I don't know if you have that handy or if you want to pull up the presentation that was like a month old.
I don't have it. I don't have it handy that I can put my finger on it quite yet, but hopefully I can get that before we finish tonight. Let's see, I think I'm pulling it up now. So, so again, this is quite literally exactly 1 month old is when it was pulled up. But we had at the high school, our seniors were 72% of them were vaccinated 1 month ago. Our juniors 63%, and it was almost like another 8 to 10% less to each grade level down to our 7th graders. And keep in mind, not all of our 7th graders were are 12 at the time. So our 7th graders were at 32% a month ago. So the high school had a overall blended across 5 grade levels vaccination rate of 58% a month ago. Our middle school, keep in mind, only our 7th graders are the ones that are eligible when they're 12 to be vaccinated. So our middle school only had 17% of all of its students vaccinated. And I don't have the numbers on our staff yet, but I'm guessing virtually all of our staff have elected for the vaccine.
We have another question in the chat that is on a different topic altogether, and that
Sure.
is someone looking for an update on the Harwich Elementary playground project.
Great question. So Harwich Elementary playground. So we are. It's the town of Harwich is the one that is that's responsible for building it, and they're working with the schools. They have awarded the contract to an entity to build the new playground, and now we are in a little bit of a challenge with New England and Mother Nature. So it does not appear that they will be able to secure all of the pieces, have them put in time to have the substrate, this rubberized substrate, poured in time. The rubberized substrate requires several days of 45-degree weather or warmer in order to set up appropriately. We had the same situation at Chatham Elementary School when they were building their new playground about a year and a half ago, where the challenge was we put the playground in, nobody could use it until that rubberized substrate went in, and that couldn't go in until the spring. So we anticipate same thing happening at Harwich Elementary School, that there will be a new playground there. It will happen this year, but it's not going to happen until the weather warms up to 45 degrees in the spring before we can go and see it completed.
There are currently no more questions in the chat.
Okay. So I will jump onto the question that Cindy had asked before on the ESSER fund, and I'll share on my screen just a snapshot of the school's website that talks about the ESSER funds. There's a presentation up there that Mike McMillan, our business manager, made to the school committee, and just sort of an overview slide of what the ESSER funds are meant to do. Just have to figure out how to share my screen or share that part. All right, are we able to see this one? Okay. So the ESSER fund, it stands for Elementary and Secondary School Emergency Relief Fund, and these were set up by the federal government. There's literally billions of dollars that has been pumped into education to support the gaps that may have occurred during COVID. And one of the things that I think we can be very proud of as a local district is that our students in the last year and a half did not experience what the bulk of the United States experienced in terms of education. When COVID first started to shut buildings, we were interacting with kids face to face using technology. When I think the bulk of the country had at best things posted online and no interaction with adults. Last year, when most people were virtual, most of our students were in person. So I think the gaps in the learning experiences for Monomoy relative to much of our state, and for that matter, much of our nation, is different, which really poises us to go and I think use these monies to go do some really great things. So some of the things that we are doing with these ESSER funds is we some experimenting this past year. We did some summer programming, really focused some of that money on some programming for English language learners who appear to have some of the hardest time during these school closures. We're going to be putting into place a lot of before and after school programming in this upcoming year. We are using some of that money to make sure that our HVAC system is completely sound, functional, and supporting maximum amounts of air exchanges in their classrooms to go and keep everybody healthy through this pandemic. We've used some of that money to add nursing staffing during this. So we have 6 nurses that are supporting our schools through this. Typically, we typically have a staff of 5 nurses, 1 for each building, and 1 nurse that floats. And this is providing us additional nurse staffing. We're supposed to use some of this money, and we'll be using some of this money to support the social emotional needs of kids. Knowing that we have some students who I think are going to be anxious coming back into to buildings. And then we have different sorts of academic interventions that we'll be using the funds on. At our elementary level, we'll be making sure that we're supporting gaps that may have occurred at the elementary level. And we can imagine that some of those bigger gaps were with our youngest kids. I think conceptually, if you think about it, the older the child, probably the easier it was for them to thrive in a virtual experience. And you can imagine that kindergartners who were doing kindergarten virtually might have some gaps that need closing. So we'll be using some of the funding there. Jen Police and I were having a conversation with Cape Cod Community College just a couple days ago, discussing with them about how we might use some of this funding to support students who are juniors and seniors who have gaps that need to be closed in order for them to be successful once they graduate. So we want to make sure that that we're using it across the range of grade levels and across all of the buildings on the school's website. So this page is under on our website. If you go to our district, under our district, there's a tab for finance, and then there's a tab for the ESSER funding under finance. Within that, you'll find the presentation that Mr. McMillan gave to the school committee on the ESSER funding. So long and short, the ESSER funding is coming to our district in 3 chunks. There's ESSER 1, which was $169,000 worth of funding, and it here Mr. McMillan's put in what are all the ways that you're allowed to use that funding. The ESSER 2 funding that's coming to Monomoy is huge. It's $653,000 worth of funding. Again, he's listed the allowable uses for it. And then there's a third, even larger amount that is coming to the district that we will be submitting for. And that's where we're really seeking out the big feedback from our community is the ESSER 3 funds, which is over $1.5 million is coming to Monomoy, and it again lists here the acceptable places that we can use those ESSER 3 funds, but it really ranges across those topics that I brought in that one pager. So these are funds that we will be able to use over the next couple years moving forward. Just to kind of put some of this into context, we started working with our administrative team and talking with the principals about, okay, how do you think we could use it in this building, in that building, in the other building? And you could imagine that if you take all of this and put it together, there's over $2 million worth of funding. Well, I've learned that if you put 4 principals in a room and you ask them how you can use the $2 million worth of funding, you quickly get over $4 million worth of ideas. So there are a lot of ideas on how we can use it. We just really want to go and get feedback and make sure that we use it to get our biggest bang for the buck, because we do, I think we do have the ability to go use this to make some significant differences, in the learning and teaching in our district over the upcoming years. So I'll stop there and just open it to questions. I think I've lulled everyone to sleep.
There are no ESSER questions in the chat right now.
But Cindy, I liked your idea on the materials for special education. I think that's one that we can put on the list on getting the same way that we're putting in a new ELA curriculum in the classroom. What can we do for the special educators to support that?
Kelly has her hand raised.
So I'm just sort of wondering, just sort of brainstorming that. My question is about your staffing and being able to staff the schools with different things that we might need, like social workers and whatnot. And I'm just wondering if you've had trouble with hiring of any of these. I know that seems to be an issue here on the Cape. And so it's great that we have all this money, but when you can't hire anyone to do that job, it doesn't really help you. So I'm just concerned that we might still be in that predicament. And I'm wondering if you have feedback on that.
Yeah, Kelly, I feel like I planted a question for you. COVID has had some interesting ripples, and one of the most interesting ripples is the impact of COVID on housing and the cost of housing on Cape Cod. And I was looking at buying a house in either Chatham or Harwich, and I was waiting, and I was thinking to myself, okay, COVID's happening. Maybe there might be some good. Maybe the housing market might become more affordable, and it went completely the opposite direction. And it went so far the opposite direction that it has impacted staffing this year. and it's something that I've shared with the school committee, and I've been sharing with our towns, is that Monomoy used to have what I referred to as pick of the litter. I mean, this is a wonderful school district. People want to work here, and we'd be able to offer jobs. People would say yes, and there you go. And we have had a couple situations this year where we have offered a job 5 different times to individuals, and 5 different times they've said yes, and then later turned around and said no because they couldn't figure out how to live here. And that's going to be a challenge for our district that going forward. And it's one of those that 2 years ago it was rarely a situation that we would struggle finding a staff member who was able to not able to join us because of housing, and overnight it has become a challenge. We do getting to the other piece of your question, we do have in this, we have hired staffing, and Michael, I don't know if you want to go through different staff members that we've added in here beyond the nurses, but we have added individuals to address the social emotional side, to address the academic side. So we've hired everybody, and knock on wood, I think we have 1 or 2 last challenging staffing that hopefully fall into place here in the next couple of days. But I think we really have, at least as of this morning, only 2 staff positions that we were left needing to fill that were challenging. But it was a far more challenging hiring season than ever before, and it's one of those completely unforeseen things associated with COVID, and who would have thought the housing market would blow up the way it did.
Yeah, so just to add to that, so we've hired a couple of math interventionists and a reading specialist, or at least have created those positions. Just one thing I would add is that it's just important to bear in mind that this funding is just a one-off. So if we hire somebody, you have to pay for them for multiple years, whereas this funding will only last a few years. And then if we want to keep positions on, we need to find the funding for that from within our general budget. So we just have to be cautious about adding positions and having a long-term plan for how we'll maintain funding for them.
Scott, there's a question in the chat asking for some more specifics on what staff has been added at the high school for social emotional teaching assistants and support staff for kids with 504s and IEPs.
Melissa, do you want to talk about what's in place and what we put in place?
Sure. So currently there hasn't been a need to add additional staff. We have 2 psychologists, and we have 4 guidance or counseling staff. In addition to the school psychologist, we have a program specifically to support students who are experiencing behavioral and mental health challenges that is supported with instructional assistance. And we did add an additional teacher at our 8th grade to ensure that the caseloads were manageable to in fact support that grade coming up. So we have a pretty robust social emotional learning framework that folks are really engaged with, and we have a team of folks that work on integrating our social emotional learning and being coaches in each of the building for staff. So we have that as part of a plan going into next year, with the ability to add additional staff to be part of that team. On top of that, we were awarded with a COIN grant, which is specifically for mental and behavioral health that provides additional professional development and puts in place our ability to assess our mental health status, so to speak, with consultation from the state team. So we have lots of things that are in place, but in terms of kids who receive special education services and or who have a 504. Those supports are already in place and will continue to be available for those students.
Any other questions?
There are none in the chat. I don't see any hands raised either.
Well, I guess we can close here. I want to thank all of you for spending your last hour learning about ESSER and reopening schools. And I appreciate your support. I think this is yet another challenging year to open schools, but we have the most wonderful staff and faculty to work with, and I really look forward to seeing the kids back in the building and just the joy that our kids and staff have working with each other. So I know it's going to be a great year, even though it's not exactly the year any of us ever had imagined. Just a handful of years ago, we wouldn't have predicted this, but we're going to make the best of it, and hopefully by the end of this year, we emerge on the other side of this pandemic and we get back to the normal we all love. So thanks for spending your evening.